Pediatric beginnings, advocate, bond, and compassion. And the location of is in Dallas, Texas. Pediatric beginning. We're going to talk about the history of pediatric home healthcare, the facilities, the service, the nurses, and COVID-19, and the mission of our company. The history of pediatric home healthcare. Ashley Nkala is the founder of pediatric home healthcare. She graduated as a licensed vocational nurse at Mountain View College, and she worked at home health about a year, and she realized every child's health is important. And so she continued her master in nursing and minor in business. In 2014, the first office opens in Dallas, Texas. Facilities. There's 3 locations. We're located in Dallas, in Austin, and Houston. We have 1,000 employees, and they provide active daily living. And we only hire all licensed vacation nurses and registered nurses that are Texas board approved. Service. We have 24-hour availability. So we're always gonna have a nurse on call 24 hours. So if you have any concern or question, you could dial the number and a nurse will answer right away. And we also provide bathing and grooming assistant, catheter care, catheter change, colonoscopy care, draw blood sample, go to the doctor appointment with you. Just if you don't feel comfortable and if you don't understand the doctor, the nurse could break it down for you even more. Also, your nurse could be an advocate to your child. Maybe she has a feeling this doctor is not treating your child the proper care as he needs, or he needed something and the doctor didn't get it as timely. The nurse will be there for y'all. And also healthcare teaching and diet supervision, IV therapy, medication ministry, oxygen therapy, trach care, and wound care and dressing changing. These are the patient resources. We have clinical portal, and that's a website that you have access so you can see your child's progress and health information. So it also has the business office information, it has doctor orders, it has patient teaching, which is very awesome, I believe, because you can see the notes and videos how to care for your child or how the nurses care for his child. So not only you have knowledge, but also the patient has knowledge to take care of himself, if he's able to, of course. And also you can view the care plan, you can view medication, and the medication tells you what it's for and what it affects and what sign system you should be aware of for that medication. And also you could view the nurse's notes throughout the shift. So if you're at work or you're not home and you're wondering how your child's care been doing, you can also view the nurse's notes to see what got done today. And these are a few insurance programs that we have. We have Blue Cross, Blue Shield of Texas, Children's Health Chips, and Super Healthcare Plans, and Texas Children's Health Plans, and Texas Star Kids. Nurses. At pediatric home healthcare, we hire, like we said, licensed vacation nurses and registered nurses. In order to qualify in our company, all nurses must be Texas board approved and also certified basic life support by American Heart Associates. And before carrying any patient, all nurses must complete an entry exam and score at least a 90 or above. Also, we check criminal background checking, annual drug screening, and also they shadow experienced pediatric nurse employee. So I think that's awesome. So your nurse know the idea what they're carrying for your child, but also you meet the nurse. So you can know, does this nurse fits with your expertise of taking your child as well. And finally, they go through a work interview with the director and nursing supervisor and charge nurse at their location of the area. So not only you improve, our staff had to improve as well. Unfortunately, we have a new virus spreading throughout the country, and it's called COVID-19, especially in Texas. And we want to continue caring and protecting our patients. As you know, our children are higher risk due to their medical condition, but also weak immune system. They have more weak immune system than us. Ours are pretty much built up, so they're more sensitive to COVID or easier access to get COVID. And we want to take extra precautions. So we're going to wear masks, gloves, critical hand hygiene, and self-quarantine as well when we're not on schedule. And you could get more updates about COVID throughout your clinical portal. COVID-19. These are some symptoms that you should be aware of. Body aches, congested, dry cough, fatigue, fever, chill, shortness of breath, and sore throat. These are very important to know. And if you're feeling any of these type of symptoms, we recommend you to stay home and call your provider and go to their app, go follow their instruction, what you should do. And also they could be prepared to treat you and see you. And these are some preventions that could help lower your risk getting COVID. Avoid big crowds, avoid touching your face, like cleaning eyes, nose, mouth. You don't want to touch any of that because since COVID is a droplet. Precautions. So those are access to get the COVID. And you want to self-quarantine and also self-monitor your health. So you could check your temperature. If you see, oh, you're running a little high, maybe you should just stay home and wait at least 24 hours and you still have the fever, call your doctor. And you want to wash your hands with soap and water at least 20 seconds vigorously, and especially around the wrist and between your fingers. Those are some areas that people tend to lack on. And wear a mask whenever you're in public. And when getting necessities, stay at least 20 feet apart from another person. COVID-19, these are some tables and charts, and it compares each location our company's at, Austin, Texas, and Houston. And it shows the population and the total cases and the total active cases. And for more information for COVID, these are two websites we recommend: Texas Health and Human Service, Center for Disease Control and Prevention. Our mission at Pediatric Home Healthcare, we believe every child deserves to be treated, not only for their condition, but as a person. As the team, we could build a solid foundation of knowledge of their illness, be a person that they can trust and care for their needs, and hopefully we could be part of your family. If you have any more questions, be free to contact us. Our number is on the first slide. Thank you very much for listening. I hope you guys have a great day.